Trainer Loren here.
And Trainer David.
So we're going to proceed with a new session. So remember, guys, if you have any questions, go ahead and continue to send us over those chats, and we will answer those questions towards the end of the session. But, you know, please do not hold back. And then remember, if you ever have any questions later on, you can always hit the training box, right, David?
You can, and we'll, that's a monitored box. We'll get back to you.
Okay, so we're just gonna go ahead and get started with today's topic, which is the Medicare Part C. So, I'm sorry, the supplement Medicare Part C. So, the Medicare Supplement Insurance, Medigap, these are a policy that's gonna help pay for some of those healthcare costs that original Medicare doesn't cover. Like, for example, those co-payments, the co-insurance, the deductibles, and then, of course, the protection against the out-of-pocket costs. So it lets your insured focus on getting better and not worrying about those medical bills. And then, of course, the flexibility to see any doctor or go to any hospital. And again, there's no waiting period. Sounds like a great option, right, David?
I think so.
So remember that this plan does not provide a standalone coverage. In order to obtain a Medicare supplement, one must be enrolled in a Medicare Part A and Part B. Now, David and I have had several people approaching us, asking us about, well, my insured only has Part A, but they have D as well. Can they get that Med Sup? Unfortunately, no. You have to have A and B. Now remember, by having only an A and B, this plan does not provide a prescription drug plan, but this is a good sales opportunity, is it not, David?
Right, there's going to be a few gaps in here still that are going to leave you with plenty of opportunity to add things to the plan, such as dental or vision.
Okay. So this plan is a Med Sup is not going to provide a benefit for vision, dental care, hearing aids, eyeglasses, even those contact lenses, which have been asked frequently, and it's not going to cover any private duty nursing, nor does it duplicate a benefit that is paid for by Medicare. Now, in prior webinars, David and I have gone into great detail. One does not need to be AHCP certified in order to sell a supplement plan. Correct, David?
Correct. But if you want to pair that with the Part D, then that would require the AHCP. But just to do the supplement, no AHCP required.
Perfect.
So let's just kind of dive into these supplement plans and see exactly how they work with Medicare and what they cover. And again, as we were saying, it doesn't, you had to have A and B. In fact, A and B are going to pay first, and then the supplement will come in and pick up the additional cost. If you look on here, it's going to address exactly how it helps with Part A to begin with, and we'll look at a couple of different supplement plans. The Plan F in both its high deductible and regular, and Plan G and Plan N. Yeah, all of those are going to cover the Part A deductible. Now, Part A deductible kicks in when the insured goes to the hospital. So 1 day, 60 days, doesn't matter. It's that deductible is $1,364. So that covers you for that first 60 days in the hospital. If that hospital stay goes beyond 60 days, then Medicare itself goes to a per day rate of $341 per day. Notice that all the supplements will cover that $341 per day while the insured is in the hospital. In those instances where 90 days in the hospital is not enough, Medicare Part A provides a lifetime benefit of an additional 60 days. So that'll take you out to 150, but that copay per day is now $682 per day, starting on day 91 through day 150, and the supplement would cover that also. So your liability under Part A is strictly going to be the premium. One of the additional things that having a supplement does for you is covers your blood usage. Now, Medicare itself does not cover the first 3 pints of blood. Amazing that most procedures in the hospital are 3 pints or less. So with a supplement, those 3 pints would be covered. Hospice care is fully covered by Medicare, and so that's really not a real concern with the supplement. But skilled nursing care, the first 20 days are covered by Medicare. But if your stay goes on that 3rd week, day 21, the cost per day goes to $170.50. Medicare supplement covers that. So your insured is going to be fully covered for their time in a skilled nursing facility. Now let's look at the way it handles Part B. Now Part B was your outpatient services, doctor visits, lab work, medical supplies. So Part B has a deductible of $185. Now, Plan F covers the Part B deductible, but none of the other plans will. And just as a reminder, on 1 January of 2020, all newly eligible Medicare beneficiaries after that date are not eligible for Plan F. So Plan F will still be around, but it's not new enrollees in Medicare will not be it will not be available for them. So that was the only one that covered the Part B deductible. Now the Part B coinsurance, Medicare was a 80-20 plan where Medicare paid 80% and the insured paid 20. All of the plans are going to cover that 20%. Now Plan N gets a little more tricky about it. There is a $20 copay for any doctor visit, primary or specialist, and a $50 copay for an emergency room visit. But all of those other co-payments for the co-insurance will be covered by the supplement. Now, excess charges. For every billing code in Medicare, the doctor is allowed, or whoever's the provider of that service, can charge as much as 15% more. So that can result in balanced billing. For the supplements, we'll cover that with the exception of Plan N. So if you put your customer in a Plan N, they will be subject to balanced billing. Just watch some of the state laws. There are a few states out there that says if it's a Medicare recipient, they cannot receive balanced billing, but you would have to check that for the state that you're selling in. And again, we already discussed the blood. Let's look at home health care, fully covered by Medicare. So you don't have to worry about that, but your durable medical equipment, still subject to the deductible and the co-insurance. So remember, only Plan F covers the deductible, but the rest will cover that 20% co-insurance for any prescribed medical equipment need, whether that be simple as a wheelchair or crutches, or more complicated such as CPAP machine, or in some cases people have asked about motorized scooters. It gets complicated when it gets beyond that. Now this additional benefit provided by the Medicare supplements is something that's not covered by Medicare, and that's going to be emergency care received outside of the US or US territories. So with a Medicare supplement, your customer does get some coverage outside the US. It's going to be emergency only. It is subject to a $250 deductible and will become an 80-20 plan. It also has a lifetime limit of $50,000. So you can see that the real goal on the Medicare supplement is to get your beneficiary stabilized wherever they are in the outside the U.S. and then returned to the U.S. for treatment. So there is coverage out there. Key thing about that, Loren, we had talked about it before, was that you have to be prepared to pay the bill and file a claim.
Exactly. My mom, who fell and broke her wrist while she was visiting family in Northern Ireland, because she's no longer part of the NHS, the healthcare system there in Great Britain, she had to pay out of pocket $20,000, and then submitted all the paperwork, claimed paperwork, and was reimbursed after the $250 deductible was met, of course. But thank goodness she had that particular plan, because otherwise she wouldn't have gotten that monies back.
Right. So that's one of the big benefits. So as we're kind of, this first part is all about the supplement. The second part would be the other option, which is the Part C. So we want to kind of keep them both in mind as we do these comparisons.
So for those of you who have insured that have families or friends that they like to go outside of the country, this is a great selling point for this particular plan, because not everybody knows that Medicare does not cover you outside of the U.S. and the U.S. territories.
They have to be prepared to pay the bill, though. Don't want to forget that part, and then file a claim to get their money back. And the other big benefit that goes with the Medicare supplement is full coverage of their liability. Okay, if they have a Plan F, all that they're subject to, or their entire liability is the monthly premium. And if they're in the Plan G or N, their liability extends to the Part B deductible. But so you can't beat that as far as maximum out of pockets and all of that. They don't even exist because there is none, right? It's just simply they're covered for whatever that cost is. And we'll keep that in mind as we go on to the next part and start looking at Part C, which is the other option for our customers with Medicare.
So remember, an applicant who is eligible to apply for the Medicare supplement insurance can only do so if they are covered under Medicare Part A and B, because again, the Part D is a separate entity. And then we have an individual who is 65 years of age and or older. Now keep in mind, there are certain states that will have a MedSup plan for those that are eligible for disability in a particular state, who are under the age of 65. So as we all know, each state is different. They have different criteria because the MedSup plans are governed by the state and not Medicare. So you will have to go in and double check your carriers as well as state to verify if they have a Social Security disability supplement plan. So let's talk about the Medicare Part C. I kind of like Part C. What about you, David?
I like Part C also. I mean, there's a lot of great benefits in here. So this is really going to be the other option for the Medicare beneficiaries. Again, you're going to have your A and B, but this is going to work a little bit differently. Now, these are actually controlled by Medicare, so you do require that AHIP certification for to go into Part C. And as we will also see here, one of the things about Medicare is there's just a multitude of names that get used and bantered about, okay? But the official name is Medicare Advantage, but it's also can be referred to as Part C. I'm trying to think of some of the others. Watch for your customers who may refer to it as a supplement. We know it's not a supplement because we're the insurance professionals, but they may, you hear terms like, oh, I have a supplement. Mine's a PPO.
Or that HMO.
Right.
Yeah.
So that tells you right away it's not a supplement.
Okay. So let's get started. The Medicare Part C. So this is the Medicare Advantage plan. So as David and I were saying, those are like an HMO or a PPO, a point of service, you know, that POS. And then of course, these have to include a Medicare Part A and a Part B. And then in some cases, you will need that Medicare Part D. So you'll also hear us refer to an MAPD. So that is the Medicare Advantage plus prescription drug.
So Medicare Advantage plans, like we said, are sometimes called Part C or NA or Medicare Advantage plans, but they are offered by private insurance companies like United Healthcare, Aetna, Humana, Blue Cross Blue Shield. There's quite a few of them out there that are offering these plans. And one of the questions that comes up is sometimes people believe that taking an Advantage plan means that they're giving up Medicare. Not true. What's happened is they've signed up with a company to provide their Medicare to them. So Medicare Advantage plans are provided and offered by private companies to provide that Part A and Part B through the Medicare Advantage plan instead of original Medicare. So it gets complicated, and you will probably have to explain that multiple times to your customer. So these health plan options are all approved by Medicare, but they're run by a private insurance company. They are part of the Medicare program, and as we were saying, sometimes they're called Part C. They're going to be available, just about anywhere in the country. I mean, there are areas that there's just, wide open spaces and there's nothing available. I can give you some examples. See the I-5 corridor north of Sacramento out west, okay, in California. You get up into areas of Montana, Idaho, Wyoming. You're not going to see a whole lot in there, but they really get down to the zip code that you live in. And beyond that, it could be in a county. You could be one county or one zip code may service multiple counties, and a plan would be available in one county but not in another. So it can when you look up these plans, it'll be specifically by a zip code and county. I've even seen cases where the county line was the street. People on one side of the street could get the plan and people on the other could not. But they are going to provide, all the Medicare covered benefits, and they may also cover some additional benefits. Remember that like Medicare didn't cover vision and dental. Many of these plans will include that. That's why we put in sometimes. So they come in these, various forms, HMOs, PPOs, special needs plan, fee for service. We'll kind of talk a little bit about these. It's going to be very similar to what you're accustomed to in the under 65 world. An HMO is an HMO. You get your care from a primary care doctor, or have your specialist or your hospitals all in the plan's network. And you're going to stay inside that network unless you have an emergency. Then by definition, the nearest hospital is part of your network. But even there, I always give people some cautions. I've seen where you go to the emergency room, they take care of the emergency, which was be covered in or out of network in the HMO, but the doctor says, hey, I'd like you to come back tomorrow, let me take a look at that. Well, remember that emergency is over, and the HMO may not cover that. So keep an eye out for that kind of stuff. So the other key thing to remember with an HMO is the referral. You can't, usually most HMOs will not allow you to go to see a specialist directly. You need that referral from your primary care doctor prior to going there. So then there's the PPO plan. Again, there's a network of doctors, specialists, and hospitals. And if you use doctors, specialists, and hospitals inside that network, your cost will be less, but you'll still pay. If you go outside of the network, it'll usually cost you a little bit more. Most of these plans will have a separate copay list for in-network and out-of-network. So I would still encourage your members to stay in the network. Now, there are also these ones that are called special needs plans. They come in different types, and it's a coverage for a specific group of people. Now, some of the examples that we list here are like in an institution. By institution, they mean like a nursing home, something like that. You could have a special plan that's designed around people being in nursing homes. Or the dual eligible, those who are receiving both Medicare and Medicaid. That's an area where we'll do a lot of business in there. Medicare, Medicaid, dual eligible. It's also kind of an open SCP, as we'll talk about. I think they can make a change quarterly if they want. But that's a type of special needs plan. Or those who have certain chronic conditions. It could be diabetes, it could be COPD, it could be congestive heart failure. Even though we would normally tell you that a person who has, the end-stage renal disease can't buy a Medicare Advantage plan, well, there are some special needs for that. They're scattered throughout the country, typically in large metropolitan areas, but there are even plans with that chronic need that are available.
But again, as David has pointed out before, those are carrier specific as well as area specific, because not all carriers want to be involved in those chronic plans, right, David?
That's true. They'll just get set up. That's why I said normally look for those in large metropolitan areas. Well, Medicare itself is a fee-for-service plan. There is an Advantage plan called the private fee-for-service plan, and it allows your beneficiaries to go to any primary care doctor, specialist, or hospital that accepts Medicare and agrees to the terms and conditions of the plan. And those are actually negotiated on each visit. So just because they would see you one time doesn't mean they would see you the next time. Okay, so they're individually for each visit negotiated, but that's called the private fee-for-service. There's a lot of other unique things about the private fee-for-service, such as prescription drug plans may or may not be included, and it's one of the rare instances for Advantage plans that you can get a standalone Part D to go with your private fee-for-service. Let's talk about the star rating system.
Yeah, so the star rating system is based upon the preventative and chronic care, the member satisfaction, the service measures, as well as the access, care, and measures. So understand, and I'd like to put strong emphasis on this, 5-star rating allows a one-time per year enrollment. So a member can change its qualifying event from a lower rating star performing to a 5-star. So basically, this to me is a great selling point. I personally would not be selling anything other than a 5-star rating. Would you say that's fair, David?
I would at least know all the 5-star rated plans in my area. Because if somebody calls in complaining about their plan and they have no other SCP, here's an opportunity for a sale.
But understand, it's only one time per year. So again, it's only for the low performing star rating. So again, great area for a sale for a person. And then you can also refer to the 2017 Medicare and You publication for additional information on that. And then of course, the word of caution, members in an HMO and a PPO, medical advantage only. Their plans cannot sign up for a freestanding separate Medicare Part B plan, D plan, to go with their MA plan. So on the fee for service, which is an MA plan only, that Medical Advantage, you can pair the standalone prescription drug plan with it. So let's talk about SEPs again. So that's that special election period. So the special election period is a situation outside of their ICEP or their AEP in which certain Medicare beneficiaries can enroll into a Medicare Advantage or the prescription drug plan. Now, these are some of the most common. If you have a situation where you question if an individual qualifies for a SEP, please email the training box and we'd be more than happy to double check and verify that information on your behalf. So for a person that has moved back to the United States or United States territory after living in another country, a person who has moved into or out of an institution like that convalescence home that David has talked about in prior webinars, or if a person has been released from jail. Now, when we're talking about jail, we're not talking about county jail, right, David?
No, we're really talking prison.
So any particular amount of time in prison, I'm not sure, but they would have a qualification once they were released. So a person that is no longer eligible for Medicaid, person that becomes eligible for Medicaid, or a plan that has no longer contracted through Medicare. And then of course, those persons that qualify for additional assistance, like that low-income subsidy we talked about.
So kind of putting it together here. So these Medicare Advantage plans, sometimes called Part C or MA or MAPD plans, offered by private insurance companies, and they are approved by Medicare. They may also cover the Part D prescription drug benefit. If you're in an MA or MAPD, remember no standalone plan prescription drug can be added to that. Now, one of the requirements about these types of plans, the Medicare Advantage, is that it has to offer a maximum out-of-pocket limit. So a person would know what their worst case scenario is money-wise on these plans. I can tell you I've seen them pretty low, down around the $2,000 limit, usually an HMO plan. And then I've seen up to $10,000, but that's usually a PPO where everything was done out of network. Okay, so, but I'd say the average out there is probably around $5,700 for a max out of pocket. And many of these plans are going to offer extra benefits that original Medicare doesn't cover. And there has just been a whole host of things that I've seen over the years, everything from medical transportation, rides to and from the doctor, the pharmacy, food being provided after a hospital stay, over-the-counter drug coverage, gym memberships. I mean, I'm rattling off a big list. I don't think I've seen one that had everything in it, but I've seen bits and pieces in a lot of different plans out there. And those can be selling features also. Now, the Medicare Advantage plan must cover all the services that original Medicare covers. Then so I've heard from time to time somebody on the customer side has said, well, I don't want that plan because they don't pay. Well, that's kind of a tough one to take on, because that meant that it was probably an item not covered by Medicare, because they're required to cover all the services that original Medicare covers. One of the other limitations they place on people, though, is that the beneficiary must live in the plan's service area. You can't see one that's on one coast while you're living on the other and you think, hey, that's a great plan, I think I'd like to join that one. No, you have to live in the plan's service area, and that can be quite limiting. Like I had said earlier, I have seen cases where people on one side of the street could buy a plan and people on the other couldn't, because the street was the county line. And of course, you have to pay your plan premium if it has one. So Part C, it'll help cover a lot of different things. Deductibles, remember all those Medicare deductibles from Part A and Part B? They'll cover that. Whereas Medicare was, an 80-20 plan, many of these will reduce that to a copay. A copay to see the doctor. I've seen them as low as 0. And I'd say a primary care, typically 0 to 20 in there. Maybe 20 to 50 for a specialist. But they'll reduce things to copays vice that co-insurance, although many of those plans still use co-insurance. Drug coverage will be just like any other Part D plan. If it includes Part D, they'll have a formulary and a structure. Preventative services, all of those that are covered by Part B, whether they be a one-time, an annual, like a checkup, or as needed, say like a colonoscopy, it'll provide that coverage for that. And then sometimes we put that with the dental and vision. They're not required to do that, but that's just one of the features that many of the plans will have for you.
So things that they do not cover, services that are not covered by Medicare. So David and I have kind of touched on this, but I know we're going to just reiterate it again. So that long-term care, also known as custodial care, most dental care, the eye examinations related to prescribing glasses, that also excludes your sunglasses that are prescription, as well as contact lenses. Now, dentures, we've been getting a lot of questions. Well, I have a client who has a partial, is that partial going to be covered, David?
No, dentures are just not covered by Medicare, nor
implants.
Comes up a lot.
Yes, quite frequent. And then, of course, remember the cosmetic surgery, acupuncture, hearing aids, or the exams for fitting them, or even the routine foot care. But David, don't you see this is a great area for an agent to sell additional plans?
Again, these are things that can be added to a plan. And a lot of this, even though Medicare doesn't cover these, there are a lot of instances where I've seen many of these picked up by Advantage plans.
Yes, especially the acupuncture, chiropractic, in a lot of those Medicare Part C plans.
Now, some of the plans that you'll come across that aren't as commonly used, one of them is that private fee-for-service. That's the one that lets the member go to any provider that accepts the plan's terms. And they may get those extra benefits with that. A lot of them will, because they're an Advantage plan, will include that vision and dental stuff. But it's a private company, and it decides how much it will pay and how much the members pay for the service. Typically, you'll find these off in rural areas where there just wasn't enough doctors and hospitals and facilities to build networks. So they'll negotiate with each one separately.
Correct.
Okay. And the other one was that Medicare savings account. It's really like having just a high deductible plan. And in Medicare, these are just not used very often. Now, when trying to decide, traditional Medicare or a Medicare Advantage plan, there's just so many different things to consider. And here's the one area that you must use a lot of caution. If the individual does have a retiree plan or a plan at work, or maybe the union sponsors a plan, joining a Medicare Advantage plan can cause them to lose that coverage. And in many cases, once that coverage is given up, it cannot be gotten back again. and you don't want to be the one responsible for that.
Right.
So be very careful if you find out that that they are participating in one of these other plans, and make sure they know that they'd be giving that up. So you're also going to want to just compare cost and coverage from traditional Medicare using a Medigap policy and a prescription drug plan, versus what would be available with the MAPD plan. So that's going to be, monthly premiums, deductibles, co-payments, out-of-pocket max. One of the questions that comes up a lot is that person who's, paying, $150, $200 a month for a Medigap plan, but doesn't even take any prescriptions and has to get badgered to get their annual checkup, right? So that really turns out to be a very expensive annual checkup for somebody who's really healthy. So you could probably just sit down and show them the liability difference, compare the cost, per year, max out of pocket, and kind of, it might be appropriate to go to a Medicare Advantage plan. May pick up additional benefits that they would use, like that gym membership or something.
Yeah, I was going to say, or that acupuncture. We've had quite a few people that are interested in chiropractic and acupuncture, and what's that other one? Silver sneakers?
Yep, that's the gym membership.
Yep.
Comes by a different names. There's a few companies: Silver Sneakers, Silver and Fit, a couple of them that come to mind. And so just keep those in mind. There's not a one answer to fit all. You also want to look at, what else that they're trying to consider, whether they want to receive these services, the providers they want, are they going to be participating? In Medicare Advantage, you always want to look up the providers, make sure that they're part of that network and that they would be eligible to continue seeing the doctor.
Now, David had a situation brought to his attention the other day. We had an agent that needed some assistance in finding the right plan for his insured. And the insured took a particular insurance company, but it was not the Medicare Advantage plan. So please double check and make sure that they take the specific contract.
Right. In that case, the doctor was in the under 65 plan, but was not in the Medicare plan. So don't make the assumption that that they're in an Aetna plan now, and that doctor would also be in an Aetna Medicare plan, because those are different networks, and you're going to have to look them up to make sure that the doctor your customer wants to see is in that network.
So again, just double check that the doctor is accepting the Medicare Advantage contract, because you don't want to assume.
The other thing that you want to look at is the plan's literature. Read through those benefits and copays. Make sure you understand what kind of plan it is, HMO, PPO, POS, and what it pays for, because not all the plans, even if they're the same type from the same company, will work the same. There can be multiple HMOs with different cost structures, multiple PPOs with different cost structures, and in many cases, different networks, different max out of pockets. So you want to make sure that for each particular plan that you're looking at those baseline benefits there. Do you need a Part D included in there? I mean, many people don't. Many are out there getting benefits from the VA, for example. And what they want is just the ability to maybe not have to drive so far or wait so long at the VA, and have just a doctor nearby that they could go to for something quick and easy. And many of those MA only plans will provide that, because they're going to fill all their prescriptions at the VA. So the MA only, remember, no separate Part D with that. Then what do you get are provided at the additional cost sometimes? Some of them will have maybe a preventative only dental plan, but if you want those dentures and stuff, you're going to have to pay extra for a full-blown dental plan as part of that. So just look at what the extras are and what services are being provided. And you also want to know, where are you required to do anything special for regular non-urgent care, or something special for the emergency room, or is it provided? Some, like we had said, will provide travel around for you, so when you take the grandkids to Disneyland, you still can do urgent care while you're down there. But we can't overemphasize the physicians. You really just need to verify that the doctors your customer wants are going to be in the network. That's usually one of the big reasons that comes up here during the AEP, that people want to change.
They want to go back to their original doctor because the person that they had dealt with before thought the doctor was in the network, and once the person was locked in, they couldn't change because they didn't have a qualifying event, and they now are switching because they can.
Yep. And well, maybe the doctor was in the network at the time and changed.
Right.
And moved, joined a different practice. And so I've seen a lot of those happen also. So the best you can do is make sure that the doctor was in the network at the time of the enrollment. Kind of another way of looking at this is kind of things that you'd want to compare the cost. Remember, with the original Medicare 80/20 plan. So we just want to keep that in mind as you look over. Medicare Advantage can reduce that to a series of copays. Compare it to the Medigap plan. You can't have both a Medigap and a Medicare Advantage at the same time, but one or the other will usually fit the situation. Extra services. Straight Medicare and Medigap will not contain any extras, but the Advantage plan, many of those they have to do at least what Medicare requires, and many will add a lot of those additional services. Nationwide coverage, well, you do get that with straight Medicare. Okay, you can go, doctors anywhere. There's no networks to deal with. The only requirement is the doctor accepts Medicare. With the Medicare Advantage plan, you're going to be in a network. It's either an HMO or a PPO usually, and if you go outside the network, there could be penalties. Original Medicare has no requirement for referrals, whereas that HMO may have that. Original Medicare doesn't cover drugs. You have to get a separate Part D. Usually with the Medicare Advantage, Part D is included. And the key thing that I always felt is that Medicare itself has no spending limits. There is no cap on what your share can be. We've said it many times, if you could find that doctor for $100, your share would be $20. But that $100,000 service for the surgery, your share is $20,000. And in Medicare, most of the facilities and doctors want that co-payment at time of service. So that's the other big reason for Medicare Advantage. Provides that out-of-pocket limit and protection against all those costs. You'll know what your worst-case scenario is going to be with the Medicare Advantage plan. So that kind of gives you a good comparison of the two, and you can see, which one of those will fit best for your customer. And of course, if you have any questions, just feel free to ask them now, or email the training box.
You always have the option to email the training box. David and I look over the box on a regular basis all throughout the day. So, please, by all means, ask away now, or hit that training box.
Let's see.
Okay, here's a good question. So let me just pull it all up. Okay, can a Medicare client escape the donut hole by dropping in a plan and enrolling under a new SEP?
That's a great question. It comes up a lot, and the actual answer to that is no. The true cost of the drugs, which is what got you into the donut hole, was all being tracked by CMS. So changing plans will not change the true out-of-pocket that the customer has spent. So you cannot SEP out of the donut hole.
All right, guys. Well, thank you for spending some of your day with us. We appreciate it. And of course, if you have any questions, make sure you hit that training email, and we will, I guess, talk with you next week. Right, David?
We'll talk to you next week. You take care. Good selling.